Hey, I just wanted to do a quick video. I hadn't really intended on doing one this quick. Again, I was speaking with some people last night, and mainly they wanted to know what how everything went down for me the day of all my extractions, and the process and how I did it and how I afforded it. First off, I've got the best grandmother in the world. She's the one that pretty much flipped a bill for me to get my teeth extracted and get some new dentures. My dentures, my immediates, which as of right now, I don't know if I'm gonna get another set for permanents or if I'm gonna keep these for permanents. I like the way they look. I think they're pretty. I really don't have any complaints or concerns other than I'm getting a sore spot. This is only day 4. It's probably due to swelling. I First off, I wasn't. I'd had extractions before, and I'd had several teeth surgically removed, especially the ones on bottom, prior to the day that I had the final 12 pulled. So I wasn't nervous, and I never had any kind of IV sedation. I hate the dentist, but I really wasn't ever scared so much. So really, with having some dental work before, I wasn't really anxious about going and having all my teeth pulled and having the denture put in. And I didn't have any tranquilizers called in, like a Xanax or Valium or anything like that before, and I didn't take anything the day of. I mean, I just went in and got the Novocaine. The biggest thing to expect, if you're doing it the way that I'm doing it, if you can't afford to have the IV sedation, or if you can't afford to have the laughing gas and nitrous, there's a few things that would scare you if your dentist isn't very informative. Most people have had fillings and they've had the Novocaine shots before, and yeah, you get numb, but they never really, at that amount, there's really not that big of an effect on you that's noticeable. But the biggest thing, the Novocaine has got a stimulant in it. It's epinephrine. I believe it has epinephrine in it. The dental assistant said that whatever they gave me, the Novocaine, lidocaine, whatever it was for the local, had epinephrine in it. So that's going to make your heart beat really fast and really hard. And if you're not sedated and you're a little nervous, it could probably throw you into a full-blown panic attack. They told me beforehand, so it didn't really scare me, but it did. For about 3 minutes, my heart beat really hard and really fast. And then after everything went numb, I was fine. The shots were the most painful thing. Other than that, the only thing you feel is pressure. Once you get through the shots, you made it through the hard part. And if you don't freak out from the epinephrine in the shots. But I had the 12 teeth extracted. They put the dentures in, and I went home. And the biggest thing was, once it seems like as soon as my mouth went numb and I couldn't feel anything, my throat went dry, and that's uncomfortable, because you can't really feel your throat that well. And you're trying to swallow, and it's uncomfortable. It kind of freaks you out. So the biggest thing I want to emphasize about the first day, I was really anticipating a lot of pain when the feeling came back, and it really wasn't bad. It was mainly just being uncomfortable. But I really freaked out, thinking, what have I done? Before any of the feeling came back, I tried to get something to drink. And before you do that, just realize, if you're going to try to drink something before the feeling comes back, you better be over a sink or over a bucket, and you better not have any good clothes on. Because even though your mouth does have the suction and the dentures are in there with suction, Your bottom not so much, but the top there it is going to bleed, and blood is going to pour out, and you're not going to be able to swallow very good. And whatever you drink, the first mouthful is probably going to end up on you or in the sink. And be prepared to clean it up. I had blood all over my shoes and my shirt, and I kept remembering, my teeth clicked, my bottom teeth clicked a lot before I got my feeling back because I couldn't feel my tongue or my throat or anything. So my tongue was wandering around in my mouth, bumping my bottom denture, making them click, and I'm like, I'm not gonna be able to wear this. There's no way. But don't be afraid. Stick it out. 2 or 3 more hours, and you know you'll be able to feel everything and control your bottom denture. I really have not had hardly any problems out of it. To be honest with you, my speech, I've had more trouble out of my top denture with my speech because my palate's covered, and I'm not used to talking with something on the roof of my mouth. I mean, the best thing that I can relate it to, I don't remember if I said this before, but if you've ever played any kind of contact sport and you've worn a mouth guard, it's what it feels like. It's like wearing a mouth guard all the time, and you get used to it really quick, and you get to where you can talk. Uh, but I, I was speaking with somebody last night. I don't know who it was, but we were talking about some of the concerns that guys have, especially young guys. My biggest concern, was functionality and just having teeth, being able to eat with them. And I probably would have left the office um, and never questioned, the shade of my teeth, which I'm glad I got this shade. They're white. They're it's a variant of B1. It's B55 is what it is. It's just a little less gray and a little less yellow in it, I believe, than B1. But it's not bleached. It's a natural color. Color is important, and the way that your teeth look are going to be important to you. So if you're getting your teeth pulled, make sure you get what you want the first time. Don't let the dentist talk you into anything. The dentist had the office had taught me into A1 at first because of my skin tone, and because they had it in stock. And if a tooth came out, they could fix it because they had it in stock. Don't let that be the reason why you pick a color. If you want straight white teeth, tell them. Get natural straight white looking teeth. Uh, I'm happy I did. Uh, and believe it or not, even as a guy, the cosmetic issues are going to weigh on your mind, and that was my biggest thing. Wondering what they were going to look like if I picked the right color. Because once they're there, they're there. Once you've got them, you don't sign off on anything you don't want. Uh, and for the next few days afterward, prepare on having some trouble with speech and maybe some sore spots, but the pain really isn't that bad. They at the end of day 2 or day 3, I started using Benzodent, and it helps. It's really helped with the sore spots. Monday, I'm going to the dentist to see if I need an adjustment on the bottom because it's rubbing a sore spot. It's been pretty irritating. Uh, but I mean, the biggest thing I want to emphasize is if you're doing it without IV sedation, it's no big deal. The only thing that's going to hurt are the shots. And if you can't afford it, if you can't afford to be sedated or have the laughing gas, you're not the only person out there. I'm there with you. And it's really not much worse than just having regular extractions done. If you've ever had your wisdom teeth pulled, it's not really any worse than that. If anything, I think it's a little better, because you have something in there to cover up the bleeding, but you are still going to bleed. I bled for almost 3 days. I mean, I still had some blood in my denture on the 3rd day, so that's not uncommon. That doesn't mean you've got dry socket. I didn't have any stitches. Every dentist is different. Most dentists put stitches in. You know, and especially if you're not having your denture put in, they'll put stitches in so your gums aren't flapping. But stitches aren't going to prevent you from getting dry socket, so that's just a heads up there. But I didn't get any stitches, and I haven't had any trouble out of it. My mouth is healing fine. If anything, it may have saved me an appointment of having to go and get stitches cut out. So I'm happy there. Um, but I mean, that so far that's really my experience. You know, I've switched dentists a little while ago because my other dentist was taking forever to get all my teeth out, and I wanted new teeth, and I wanted to be able to eat. Ate biscuits and gravy today. Ate, you know, like I said, some Salisbury steak yesterday, and I mean, you can eat soft things. I mean, anything you know that you're comfortable with trying, just try it slowly. Uh, and if you're about to get your teeth pulled and you're freaking out because you're not going to be sedated and you can't afford it, don't worry. I mean, it's maybe 4 hours of really being unsure, but hopefully this video will help you be a little more sure of yourself and know that you know when the feeling comes back, you're not going to pass out from pain. You're going to be bleeding. That's normal, and your heart will go crazy a little bit when they do give you the shots. Uh, but anyway, if there's anything else that you know that I can talk about, I really hadn't anticipated on making a video this quick again, but you know I'd spoke with someone last night that were having their teeth pulled, um, and they weren't having you know IV sedation, and they were scared. So I kind of figured it'd be good to make a video about what it actually feels like when they give you all the shots and they pull your teeth, and what to expect. So, but if you have any more questions for me, I'll try to get to another video in a few days. But that's pretty much it.